Welcome to Advancing Health. Medical complications at birth can sometimes prevent new parents from holding their babies and beginning the bonding process right away. Today we hear about how one major health system encourages other ways newborns and new parents can start to connect from birth.
Welcome to Advancing Health. I'm Julie Kim, Director for the Division of Health Outcomes and Care Transformation here at the American Hospital Association. Picture this. Your baby is just hours old, hooked up to monitors in an NICU, and you're standing at the bedside not knowing what you're allowed to do. That's where today's conversation about health literacy begins. Joining me are Gabriela Jimenez Thompson, Program Lead for NYC Health and Hospitals Bellevue, Our Story Begins program, and Liliana Escobar, Bellevue's head NICU nurse. Gabriela, Liliana, thanks so much for being here.
Thank you, Julie, for having us.
Of course, let's dive right in. Gabriela, could you start by telling us more about Our Story Begins program, what inspired it, and what it looks like in practice?
Yes, of course. So Our Story Begins started out of a dream to create equity. So we are a part of the Reach Out and Read model at Children of Bellevue's Reach Out and Read, where we promote early development and early literacy as a standard part of well child care. We noticed that the NICU babies didn't have this chance to have access to resources. So Our Story Begins was born. We wanted to make sure that caregivers knew that their voice was just as important at every point of their child's life and then a very important part of their child's care. So through nurse education, babies are receiving books at admission every month that they're also receiving care within the NICU, and also once at discharge to make sure that they have all the resources they need to make sure that their language and cognitive development is fully operational.
That's great. And Liliana, from a clinical perspective, what does that critical window of bonding look like in the NICU? And why is that so important to support families during that time?
This is a window that's very important for every newborn, not just for NICU patients. That first touch, that first voice they listen to. It just gets very difficult when the patient comes in the NICU because you're taking the patient away from the mom. Sometimes they're not able to hold them right away. So how we encourage this in the NICU is, we offer skin to skin as soon as possible when the patient is stable. If they're not able to do skin to skin, we offer touch, like soft touch for the babies. And now we have the program Our Story Begins, which is also one thing the parents can do to create that bonding during this critical period.
That's great. And NICU families often feel helpless when they can't hold their baby. So, with this program, could you talk a little bit more about the role that it creates to their child's care?
Yes, I think this program allows the parents to be more of a caregiver instead of just an observer. They come to the NICU and they see the nurses, the doctors doing all this medical procedures on your patient, and they feel helpless. And having Our Story Begin, it gives them a purpose. It makes them part of the plan of care, having something to do and knowing that they can do something for the baby that's going to help them in the long run.
Back to you, Gabriela. I remember you mentioning the living room language, right, when talking with the families. So could you tell us a little bit more about what does that mean in practice and why does it matter in a clinical setting like the NICU?
Absolutely. I think I also will build on Liliana's point of this is a very vulnerable time for these parents. They're coming in with new sounds, new and like a completely new environment that they've never been exposed to before. They're extremely concerned about their child's well-being, being able to ground them in these everyday routines that they will hopefully do once the baby's discharged of talking, reading, and singing to their baby is such a pivotal part. We also know that babies look for these caregivers, and that's why we want to bring it back to living room language, because the word that they heard every single day in their mother's womb is something that they're looking for in this environment as well. Living room language is intended to take away the medical jargon, remembering that we are all human beings and sometimes need that human to human interaction to really understand what is going on. Our Story Begins gives our parents an opportunity to recognize that every single day that you talk to your child, it gives them a point of comfort. There's a lot of medical jargon that will be going on around them, but this gives them an opportunity to remember that their voice does have power. And also, if they have questions, they should ask them and also understand what is going on with their child. I know that a lot of moms will ask about their child's weight, how they're growing, how they're changing. And sometimes it's great to just hear it in everyday language.
Well said. And Liliana, we need to talk about the nurse's role here. What does that look like beyond the clinical care? I mean, I assume, there's some coaching involved with the families and helping them to feel more confident and building trust also, right? How does that look like?
In the NICU is the baby is not just our patient, like the parent is also our patient. So we also have to attend to them, making them feel confident that they can participate in the care of their patient, helping them recognize that, they're essential for the baby's care. If we all usually tell them, nobody knows your baby more than you, right? And we try to create that confidence in them, giving them education, helping them participate in what they can, even if it's just changing a diaper, taking a temperature, know when your baby is stressed, learning how to calm him. You might not be able to do any medical, but these things that your baby needs are very important also, and helping them succeed in their care in the NICU. And confidence, it takes time to build, especially you get a 25-weeker, 600 grammer, the parents are scared, and it's just having to build that confidence over time, explaining everything that we're doing. Why is your baby getting this medication? Answering any questions they have, helping encouraging participation on rounds every day so they can ask questions not just to the nurses, the medical team, every provider, and creating that trust with the family. So, they feel empowered that they can ask questions and participate every time, every day.
Super important. I believe that it's one thing to design a program like this, and it's also another to see it actually reach families at scale. So let's talk numbers and impact that this program has had. So, to my understanding, the Our Story Begins program has reached 72% of all NICU admissions. Gabriela, what does that kind of reach mean for families at Bellevue, and what's driven that uptake?
It definitely takes a village to raise a child. You see it every day in the NICU, from nurses to parents to social workers to like everybody is really considering the importance of these children and making sure that they have all of the protective factors to ensure that their success and hopeful discharge. The 72% was people wanting to see these babies have this wonderful interaction with their parents. It took educating the nurses on the impact of early literacy in child development, specifically neonatally. And it also took a lot of reinforcement and reminders. We've been able to share upwards of 735 books. So it does take a lot of attention to detail, but when you see the atmosphere that it's helped create, it's offered a positive moment for nurses to be able to give this book to this family and not necessarily just talk about the medical complexities of their child, but they also just get to relate on a human to human level. I think the biggest driver of this work has been relational health, especially early relational health, of thinking about what do these babies need in order to really thrive lifelong. So I think that connection, intention, and very calculated research to make sure that this initiative is the most impactful, not just developmentally speaking, but also up to date on all of the latest information that can be available to families.
That's great. Thank you for sharing that. And Liliana, a question for you, and perhaps to the both of you. Is there a patient or family story that has stayed with you since the launch of this program? One that may illustrate why this work truly matters?
I think the whole program itself have created a change in our unit, how parents experience the NICU. From what I remember, one of our patients who had a very premature baby, very small, at first she was very scared to touch him. We encouraged for her to read as a first thing to bond. Little by little, she started putting her hands in the giraffe and the isolate, touching the baby, until we were able to have her hold the baby for the first time, even when the patient was intubated on the ventilator. And even then, she's like, let me read the book while we're holding the baby. And, that made me feel like so important. Like reading the book really connects the mom, the parents, other family to the baby.
Of course, there was, and again, most babies have very complex conditions, and sometimes they'll be there for upwards of 4 months. And there was a family who ended up having a baby who was admitted for 6 months into the unit. The first book that she got, she did not want to hear anything outside of the fact if her child was going to be okay. So she was very reserved, didn't really want to think anything outside of this moment. It was extremely stressful, so she just couldn't see forward. By month 2 and 3, she started to actually gravitate towards the books and started to read to her child. And then over time, she actually told me that one of her favorite books, the Chicken Pio 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 song, was something that she did every single day. And at the day of discharge, she actually cried to me and she said, this reminded me that I am a mom and I need to show up every day. And no matter how hard it was, this gave me the grounding to know this is just a moment of my child's life. And I will be able to give him all of this love and care afterwards as too. And it's my responsibility as a parent to focus on this moment. And she was grateful for the nurses who constantly encouraged her. And for each moment that she was in this stressful headspace, she would allow herself to pull the book out to give herself a break to remember, although this is stressful, I can remember that I'm bonding with my child. And that's the most important part of this program, is hearing that from families and knowing that in this stressful time, this gave them a chance to just focus on that connection that they're longing for ultimately.
I know our listeners can't see us right now, but I'm smiling ear to ear to that heartwarming story. Thank you both for sharing that. And I believe there is a chain of events here, right? Or connection that is to be made. And that's the human to human connection, being intentional, being consistent. And it's all surrounded with love, it sounds like. And that this kind of impact says a lot about where this program is also headed for the future. So before we close, I want to zoom out a little bit. So what outcomes, right, are you hoping to measure as the program grows?
So we're measuring several things. One, of course, we want to ensure that every baby gets their books when they're admitted into the NICU alongside their nurse education. But on a larger scope, we're hoping to bring back volunteer readers to make sure that there's this interaction that can happen to every baby, regardless of their parents' ability to visit them. And in addition, there's limited gaps of research actually that talk about the importance of just vocal infant-directed stimulation within the NICU. And we know that it's very important. Babies get desensitized to hearing all the beeping and all the voices talking around them. But we do know that when our voice and our name is called for, we're able to tune into that. So we want to really focus on making sure that the visibility and the importance of these child-directed interactions are a standard part of well child care and NICU care, hopefully going forward. And that's what we're hopeful for, is making sure that resources are available to families regardless of their native speaking language. And if they need literacy resources themselves, that they can be available. We want to show that storytelling is a powerful tool to help encourage healthy development.
Great. And the last question here I have for you is, if you could leave healthcare leaders, right, with one message about the importance of health literacy, what would it be? And Liliana, let's start with you.
Sure, Julie. I think it's just understanding that health literacy is not just about speaking simple words. It's making sure that every patient understands their plan of care right now, today, tomorrow, and they feel informed, respected, and empowered, that they can make decisions about what their care is. You know, it's not just, let me give you a pamphlet that speaks simple language. It's making sure that they're understanding, and everyone is, no matter your background, your education level, or your language. And just making sure that this is not just one person's job, it's a whole health system. Just making sure that every person gets that opportunity to feel that empowerment in decision making in their care.
Great. Thanks, Liliana. Gabriela?
There's a lot of power in connection and remembering that we are all just human. And sometimes it takes a moment in a present time. I know we always have a long to-do list, but spending that extra moment with a family does go a long way. I think one of the most important things too is we want to be proactive, not reactive. So making resources available to help maybe create a safety net for these families. And if you are able to do so, whether that be giving them information that can help them be prepared for tomorrow, or maybe even something that can help them get through today, it's a very important thing than having to think about the possibility that they're going to be in a situation that they're unable to respond to. One resource that actually one of my moms told me, she's like, please make sure you highlight and share is pathways.org. After discharge, we make sure that families have resources so that they can keep track of their child's development. And if they're noticing something that isn't necessarily up to the typical milestone, they can notify their doctors because they are their strongest advocate. I think allowing ourselves to remember that our families, patients are their own advocates. So we should listen to any concerns that they have, give them the resources proactively to make sure they have all the care they need.
Very important. Well, Gabriela, Liliana, thank you both for your time today. We look forward to the continued success of this program. And to our listeners, we hope that this conversation sparked a question worth asking. What does health literacy look like at your organization? And we'll leave you with that. Thank you so much for tuning in today.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.